Nancy.
How you doing?
Hi, I'm Henry Longobardi. I'm one of the owners of Compassionate Home Care.
Nice to meet you, Henry.
How are you?
Oh, I'm at my wit's end with my mother.
Well, what can we do for you?
I'm really hoping you can help me because she's driving me crazy. I've come down here several times. This is like the final time I can handle this right now. My mother is just as hard-headed as can be. She will not come live with me. I've offered and offered and offered. She will not leave Florida to save her life. She has a problem. She falls down. She's getting elderly, and no one knows for days until she can get to a phone sometimes. This past time, she was on the floor for a day before she got to a phone and got to me. I just really need some help, and I hear your company is able to send people or somehow or another to help me out with this problem.
Okay, yeah, we can do that. Compassionate Home Care Network is a state-licensed nurses registry, and we have nurses' aides that we can refer to your mother to take care of her in her home. They can do a variety of things for her. They can assist her, first of all, with any personal care needs she may have. So like you said, since she's fallen down several times, if she needs assistance with bathing, toileting, standing and walking, getting dressed, the aides can help her with those things. Additionally, they can do things like keeping her bedroom, her kitchen, her bathroom clean. They can do the laundry for her, the washing and drying her clothing, bed linens and towels, prepare meals for her. If she needs to go anywhere, the aide can transport her, take her to the doctor's appointments or to the store. Or a lot of my clients, they like their aides to take them to the hairdresser. That's a big deal.
Absolutely.
Once a week. So typically, those are the types of things that the aide can do for her. Everybody that we use, we do a criminal background check on. We need to see original documentation that they are legal to work in the United States, which is a big problem down here in South Florida.
Okay.
We also need to see original documentation of their training. We give them a 100-question test to verify that they did understand the training and that they are literate.
Okay.
And they have to bring us 4 verifiable references, which are usually people they've taken care of in the past or family members of people they took care of, which are really nice references for us. We don't require on her part any commitment for a particular schedule, a length of time, or any particular aid. All those things are changeable at any time. Mm-hmm. She can, if she wants to stop service, she just needs to give us 24 hours notice that she can stop service.
Okay.
Any questions?
Well, actually, how is this different? Because I know some of her neighbors have like a private company, a private nurse that would come in and
that they've hired themselves?
Yeah, that they just take out on their own.
Okay, that can be done successfully, and quite often it is less expensive, but there are some pitfalls to it. Worst case scenario, there's some people out there that are working privately, mainly because they can't pass a criminal background check, or there is something else in their background that would disqualify them from working through a company like Compassionate Home Care Network. There was a case a little over a year ago down here in South Florida that was in the papers where a lady hired an aide that one of her neighbors was using, and over a 6 or 7 month period, she stole over $400,000 from the lady. Now, unfortunately, this was discovered. Most of the money was recovered, and this particular aide was arrested. But as the article pointed out, the aide did have a criminal background. She had prior criminal records, so had she gone to a company like Compassionate Home Care Network, that person would not have been one of the aides that we would have referred, because she would have never passed the background check that we would do.
I understand.
Okay, now the other side of the coin, say like you get an aide that's really, really good, and everything's going well. And then after a while, your mother and the aide just get tired of each other, and they start getting a little bit on their nerves and so forth. The aides can sense that, and they will pick up on that and start to dominate the client. Say, well, I know you don't like me anymore. If you don't like me, I'll just get up and leave now, knowing that the aide is dependent on, the client is dependent on them, and almost like a casual threat that, like, if you don't want me, I'm going to leave right now. Well, they need the aide every day, so what are they going to do? So you generally apologize to the aide, and they just carry on in a bad situation.
Right.
The best situation is that they get along for an extended period of time, and everybody's happy with each other, which does happen, quite often. But every aide, no matter how long great they get along with the client, needs days off. And generally, when they take days off, it's going to be the aide who refers someone else to take their own place with the client. And there you don't know what you're getting. Now, sometimes the aides work with regular people that they know very, very well, and everything is fine. But on the other side, you get the aide may have met another aide in the doctor's office waiting room and exchanged phone numbers and doesn't really know anything about her other than her name and phone number, and just needs somebody to replace her for that day, so you don't know what you're getting. Now with us, it's situations like where your mother has an aide she really likes, and we send back the replacements in there when the aide cannot be there. Anyone that your mother does not like as a replacement, all she has to do is tell us about it, and that goes into her record in the computer system, and when her aide can't be there again, that aide comes up as a do not use for your mother, so we would never send her back, again.
I understand.
Okay, so basically that's the differences.
Okay, well, in knowing that, knowing how hard-headed my mother is, I would have to maybe, if it would work with your company, maybe meet a couple of the aides and see how things go and see if she likes the idea. And, maybe I have to leave by Friday, so I really, really need to get this underway to see, how she's going to respond.
Sure. Well, we have a lot of aides available in the area, and we certainly can arrange that. Now, we have a little bit of paperwork to do. If she doesn't like anyone, then there's never any commitment. She doesn't have to use us. So let me go get that, and then we can get started, and then we can make arrangements to have some aides come over to your mother's home at you and your mother's convenience, so that you can meet with them and make a decision as to what you want to do.
I think that would be a really great idea.
All right. I'll be right back.
All right, thank you.